Now, today we'll be talking about moderate COVID-19 disease. When we can label a patient that he has moderate COVID-19 illness, the patient has to fulfill one of two criteria. First, the respiratory rate of the patient has to be or equal to 24 or more than 24, and the patient should have shortness of breath, and the RR should be less than 30. If the RR is 30 or more than 30, we label that patient has severe COVID-19 illness. So this is severe COVID-19. So RR more than 24 but less than 30, and saturation has to be between 90 to 93. If it is less than 90%, we label that the patient has severe COVID-19 disease or severe COVID-19 illness. Now, any patient who has moderate COVID-19 illness must be admitted in the ward, must be admitted in the hospital. It is not mandatory to admit such patient in ICU. The target saturation of that patient will be between 94 to 96%. If the patient is known COPD, then the target can be kept in between 88 to 92 as well, or up to 92%. The patient must be facilitated for awake proning, that is, every 2 to 3 hourly, patient should sleep in prone position or his abdomen to facilitate more and more recruitment of the lungs and better oxygenation with lesser oxygen supplementation. The most important drug whenever there is moderate COVID-19 illness is steroid. It is extremely important for these patients to receive the steroid. So the dose which is given is injection dexamethasone 6 milligram per day, or equivalent dose which is methylprednisolone 32 milligram per day, and that can be given in divided dosage. We must know that the 0.75 milligram of dexa is equal to 4 milligram of methylprednisolone is equal to 5 milligram of prednisolone. And DEXA can definitely markedly increase the blood sugar, especially if the patient is obese or if the patient is known case of diabetes. So in that case, sugar should be definitely checked very cautiously, at least fasting blood sugar, pre-lunch blood sugar, pre-dinner blood sugar, and if it is required, then postprandial one after 1 hour or 2 hour or after 3 hour should be considered, and sugar should be managed, otherwise it can cause hyperglycemia and other complications of hyperglycemia. Injection remdesivir is one of the most important medicine that is required for moderate COVID-19 illness. I'll be talking that in a little half. Steroid should be given for around 5 to 10 days or until discharge, whichever is earlier. So if on the fifth day the patient is much better, his saturation improves, he's walking, talking, then we can discharge. Or if the patient has some symptoms, then steroid should be continued at least for 5 to 10 days as per the patient's involvement. The research I have already told. There should not be any steroid given after discharge that won't improve the medical condition, and it can increase the risk of mucormycosis, and it can increase the risk of secondary bacterial infections. Regarding anticoagulation, as we know, moderate COVID-19 illness markedly cause damage. It can cause SIRS. Patient can land up into severe COVID-19 illness. So chances of thrombosis markedly increase. So prophylactic anticoagulation in moderate COVID-19 illness is very important. In those patients, either unfractionized heparin or low molecular weight heparin must be given in prophylactic dose. Low molecular weight heparin is very commonly preferred, so enoxaparin or clexane by the dose of 0.5 milligram per kilogram per day subcutaneously must be given to all the patients who have moderate COVID-19 illness. Regarding investigations, CRP D-dimer, they should be definitely done every 2 to 3 days, and CBC, that is hemogram, kidney function test, liver function test, must be done every 24 to 48 hours, so that the steroid dosage, the remdesivir dosage, or the other medicines whichever the patient is on can be monitored, and patient's multi-organ dysfunction can be evaluated as per. So we will be not talking about remdesivir. Now we must know remdesivir is indicated in moderate COVID-19 illness disease as well as in severe COVID-19 illness disease. It is a broad spectrum antiviral disease. It is recommended for both moderate as well as severe COVID-19 illness who are at high risk of progression to severity or death. Remdesivir must be started within 10 days of onset of the symptoms. The symptom can be cough, weakness, tiredness, exhaustedness, whatever the symptoms the patient had the earliest. It should not be given to those patients who are not on oxygen support, those patients who have good saturation like 97, 98%, 99%, or 94%, those patients who are not needing oxygen support, these patients should not be given remdesivir. Monitoring kidney function test, liver function test is very necessary. If the glomerular filtration rate is less than 30 ml per minute, or if the SGOT, AGPT, or AST, ALT is more than 5 times upper limit of normal, then remdesivir is usually not recommended, even though this is not an absolute contraindication. So in at this instances, remdesivir should be used very, very cautiously. Remdesivir should be given for 5 days only, and if the patient has insufficient or not that much great response, or if the patient lands up in severe COVID-19 illness, then remdesivir can be given up to total of 10 days. So we know that moderate COVID-19 illness to label-it patient must have RT-PCR or antigen or HRCT, which is very highly suggestive of COVID-19 with RR of 22 or more than 22 and a saturation of 90 to 93. So this was all about moderate COVID-19 illness. Thank you.